Welcome to Cody Regional Health's Total Joint class. My name is Denise, and I'm a registered nurse first assist for Cody Regional Health's Orthopedic Clinic. So, you've decided to proceed with your total joint replacement, and we're so happy that you're taking a few minutes to learn about your upcoming surgery. Here at Cody Regional Health Orthopedics, we believe that an educated patient is a more successful patient, and hopefully you'll learn some key items from this video, and you'll have reasonable expectations for after your surgery. Before your surgery, you'll most likely need to meet with your primary care provider for surgical clearance and some tests, like an EKG and labs. You may even need to meet with your cardiologist if your health history requires it. This is all to make sure that you're healthy enough to have a safe surgical outcome. If you're having a total knee replacement, you may be scheduled for an Iovera treatment approximately 1 to 2 weeks prior to your surgery. Iovera is a simple procedure that temporarily freezes the superficial nerves on the front of your knee. This procedure will not make your total knee pain-free, but we have found that many patients having this procedure tend to gain their range of motion quicker. Once again, this will not make your total knee pain-free. To be honest, the first 2 weeks after a knee replacement can be very difficult. The best description I've heard from a patient was, "Denise, I'm really having some buyer's regret after this surgery." Just know you will get better. A few other ducks to get in a row before your surgery to make your transition home a little easier. Have some meals laid in and have all that laundry done. Do you have any help at home? This is a great time to take family and neighbors up on that help they've always been offering. You will also need to arrange for transportation because you'll not be allowed to drive, and you may need to attend physical therapy up to 3 times a week. If you take aspirin, ibuprofen, or meloxicam, you'll need to stop taking those 7 days prior to surgery. If you take a prescription blood thinner, your prescriber will instruct you on when to stop those prior to your surgery. You'll be contacted a few days prior to your surgery and instructed on which medications you should take the morning of your surgery with just a sip of water. They'll also tell you what time you should arrive on the day of your surgery. The day before your surgery, we ask that you bathe or shower as normal, and you may be given some antibacterial wipes to use to help reduce the risk of surgical site infections. Now, I'd like you to meet your new best friend, your physical therapist. They'll assist you in being successful with your total joint recovery.
Hi, I am Heidi, an occupational therapist here at Cody Regional Health. I would like to go over some equipment that you may benefit from getting prior to your surgery. You will need to get a walker. We recommend a front-wheeled walker. However, you may use a 4-wheeled walker or even a cane later in your recovery. Please get your front-wheeled walker and you can bring it to the hospital or pre-op appointment for fitting. Depending upon your height and home toilet, you may need a raised toilet seat or a bedside commode. We recommend that you trial the raised toilet seat prior to surgery to ensure that it's going to fit correctly and secure to your toilet. The bedside commode can also be placed over the toilet or next to the bed to assist with safety and mobility. There are several options to assist with shower safety. If you have a walk-in shower, consider getting a shower chair and making sure you have solid grab bars installed. A handheld shower head is also helpful. If you have a tub shower combination, an extended bath bench may be your safest option. This allows you to sit down on the edge of the bench and lift your legs over versus stepping over the edge of the tub. Occupational therapy will also be able to assist with adaptive equipment like a reacher, sock aid, shoehorn, and leg lifter to help with your activities of daily living and dressing tasks following your total joint surgery. Now you're going to hear from a physical therapist.
Hi, my name is Monique and I'm a physical therapist, and I'm going to talk to you about a physical therapy preoperative appointment and why you should attend one. A physical therapy preoperative appointment is going to cover a lot of different things that you'll need to know before you have your surgery. Some of those things will include the needs that you have for different aspects of your mobility. Part of that is your equipment that you're going to need, whether you need a walker, slings, or any other equipment that might come into play for your particular procedure. During that appointment, you'll learn how to use the equipment, such as your walking devices, your walkers, and your canes. And if you have a total knee replacement, some of your physicians might refer you to a continuous passive motion machine, or a CPM. In your preoperative appointment, this can be a period of time where you can learn how to use that piece of equipment. Another aspect of your preoperative appointment will be your mobility. Oftentimes people struggle with bed mobility, stairs, or how to use their assistive device, and during your appointment we can cover these things too. Sometimes people have precautions that they need to learn about prior to their surgery. Some of these include learning about infections and learning about DVTs or deep vein thrombosis. Other people have mobility restrictions that you might have, for example, with a total hip replacement. There are other precautions that you might need to learn about as well if you have a weight-bearing restriction. Additionally, in your prehab appointment, you'll learn exercises that are specific to your rehab protocol. Some of the things that you might be restricted in doing and some things that you'll be encouraged to do. Some of these other things that you'll cover in your rehab appointment are precautions and any restrictions that would be related to your procedure. Finally, you'll receive some education on just how long you should be in therapy from an outpatient standpoint as well as your hospital stay.
All right, everybody. We've come to what I like to refer to as game day. It's very important that you do not eat or drink after midnight, or anesthesia will cancel your surgery, and we've come too far together for that. This includes coffee, tea, water, or gum. If you do get thirsty, you can always swish and spit. A few things that you may want to bring to the hospital are your walker. Then PT can fit your walker for you. Loose clothing, because one of your goals for discharge is being able to dress yourself. So stack those cards in your favor. Sweatpants, shorts, muumuus, slip-on shoes. But leave your cowboy boots at home. If you use a CPAP, please bring that to the hospital. And I always suggest you bring your own toothbrush. We provide a really great kit with a drinking cup, facial tissues, chapstick, and the worst toothbrush ever. And don't forget your cell phone charging cord. Your surgery usually lasts between 1 to 1.5 hours. After surgery, you'll be in the recovery room for 45 minutes, but you'll be resting and most likely won't remember this portion because you're pretty sleepy. Now is when everyone asks, when can I go home? Gee whiz, we just got you, and you already want to go home? You'll need to pass certain goals to discharge to home. Rehab will have you walking 150 feet, getting out of bed, and negotiating stairs. So the answer is when you're ready and safe to go home. Everyone's different. While you are here with us, please do not get out of bed unassisted. We do not want you falling down because that ruins everyone's day. You may have a dressing that's designed to be water resistant, so you can shower after surgery without having to try to wrap yourself in press and seal. If you do have one of these dressings in place, please leave it alone until your post-op appointment, where we will remove it in the clinic. No peeking. So you've made it home. Yay! Ice and elevation are very helpful, especially with a knee replacement. And by elevation, I'm talking elevating that new knee above your heart. So if you're chilling in your recliner, you may need to place a couple pillows under your operative leg to get that elevation. But here's the catch. Don't place those pillows under your knee where they might feel a little better. You're going to want to place them under your heel to encourage that new knee to fully extend. If you're having a knee replacement, you may or may not be provided a CPM. This will be coordinated by the care team. Our Cody Regional Health Ortho Surgical team have done our part. Now it's your turn. This is where the real work begins. You should anticipate to follow up with therapy within a week.
After your surgery, post-op day 1, physical therapy and occupational therapy will evaluate your mobility needs and determine a plan of care for your hospital stay. Typically, it includes evaluating your safety, your mobility, and even how you perform on stairs. You'll receive exercise education as well as education in transfers and your ADL activity, which is called your activities of daily living. Typically, this time frame can range from anywhere from 1 to 3 days. Additionally, part of your in-house stay in the hospital will include caregiver or family training to assist you with your transition home. Within a week of your surgery, your post-operative outpatient therapy will begin. Your doctor can recommend or refer you to outpatient physical therapy. On your first visit, make sure you give yourself enough time to get to physical therapy because your body's going through some challenging times. During your first physical therapy visit, your plan of care will be established, and your future visits will be coordinated at this time. Depending on your procedure, therapy may extend from weeks to several months and will involve coordinating with your physician and your therapy team. During your first physical therapy visit, the therapist's plan of care will include education related to your diagnosis, detailed therapeutic interventions based on your post-surgical needs, and training to progress you through your specific surgery.
We all want to thank you so much for taking time to learn about your total joint replacement. And we all hope that this video has provided some education and helped reduce some of the stress and anxiety that you may be feeling before your surgery. If by chance you have more questions, please feel free to reach out to us.
To contact Cody Regional Health Rehab Services, please call 307-578-2452 or Cody Regional Health Orthopedics at 307-578-2180.